Hi, my name is Carine Wellington. I'm a PhD student at the University of Maryland School of Public Health. Today I will be talking about building a workforce for mental health demand through a scoping review. Background: mental health is a significant public health concern. Research indicates that the COVID-19 pandemic has further exacerbated existing mental health disparities. As the demand for mental health services increases, it is imperative that the workforce supply of mental health professionals increases concurrently. Objectives: we conducted a scoping review to synthesize peer-reviewed articles that examine the following. 1. The demand for mental health services during and after the COVID-19 pandemic. 2. The workforce supply of mental health professionals during and after the COVID-19 pandemic, and identify evidence-based policy solutions. Methods: using PubMed, we identified peer-reviewed articles published between 2020 and 2022 that assess the demand for mental health services and the workforce supply of mental health professionals during and after the COVID-19 pandemic. Variations of key search terms can be found in Figure 1. Inclusion and exclusion criteria. Inclusion criteria: peer-reviewed articles that discuss the direct impact of the COVID-19 pandemic on mental health service demand and mental health professional workforce supply. Exclusion criteria: peer-reviewed articles that did not assess the direct impact of the COVID-19 pandemic on mental health service demand and mental health professional workforce supply. Preliminary results. Through our scoping review search using the key search terms, a total of 3,280 records were identified through PubMed. Once duplicates were removed, a total of 1,274 records remained. This is an ongoing project, but at this stage, 300 records were screened for title and abstract, of which 184 records were excluded. A total of 116 full-text articles were assessed for eligibility, 94 full-text articles excluded with reason, of which 43 were excluded for out of scope and 51 for insufficient detail. At this time, 22 articles have been included in our scoping review synthesis. Based on our preliminary results, containment strategies implemented during the COVID-19 pandemic have had lasting effects and are continuing to drive the demand for mental health services. The frequent turnover within the mental health care workforce resulting from burnout is fueling the workforce shortage. The workforce shortage has created disruptions in the continuity of care for patients and diminishes access to mental health services while positions remain vacant, further exacerbating existing mental health disparities. Recommendations: we are recommending evidence-based policy solutions to boost workforce recruitment, retention, and foster a robust workforce, increasing equity in access to mental health care services. We are recommending the following. Loan repayment programs should be expanded for mental health professionals. Medicaid reimbursement policies should consider increasing reimbursement for those mental health professionals treating individuals in underserved areas and/or with serious mental illness. And 3, mental health professionals should be provided with ongoing training opportunities to reduce skill gaps. Acknowledgements. Thank you to the University of Maryland Graduate School Office of Funding Opportunities, the School of Public Health, Department of Health Policy and Management, my academic advisor, and Xavier University of Louisiana for the opportunity to present my research.